Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our weekly update on the COVID-19 pandemic. As Dr. Bogan will be reporting, we continue to see cases on the rise. We're also seeing an increase in our hospitalizations and unfortunately our fatalities. We do see the increase in vaccinations. We're almost 75%. We got 690,000 people in Allegheny County who are fully vaccinated and another 70,000 people with one shot. And we've got to continue the vaccination. I mean, the data gets more clear every week, every day of the effectiveness of these vaccines. And of course, as will be reported and was reported earlier this week, the FDA fully approved the Pfizer vaccine, and but all three of them seem to just, the evidence is overwhelming. And as we start back to school, we're glad to see so many of our school districts have come in and instituted mandates, and we're hoping that the rest of them do in the next few days. So with that, let me turn over to Dr. Bogan to give her update. Dr. Bogan?
Thank you, County Executive. Good afternoon. Thank you for joining us. Let me start with the data. Although the PCR positivity rate remains steady from last week at around 5%, the number of cases of COVID-19 are increasing. More slowly than in late July and early August, but certainly increasing, now to about 225 new cases each day. Unfortunately, but not unexpectedly, hospitalizations are also increasing here in Allegheny County. As I've said many times before, hospitalizations lag a couple of weeks behind cases, and that is why I said not unexpectedly. We are not overwhelming our hospital systems like we are hearing in the news from states with low vaccination rates like Florida, Alabama, and Mississippi. Nonetheless, most of those in our hospitals with COVID-19 are the unvaccinated. And it's challenging for medical staff across the country and locally to provide critical medical services when they know this was preventable with a vaccine. I'm also sad to report an increase in deaths this week, including a few young people, young at least by my standards, people younger than 50, people younger than 65. We continue to see breakthrough cases, which is to be expected with the Delta variant. But we also continue to see the effectiveness of the vaccines because, as I already said, most people who get hospitalized or die from COVID are people who were not vaccinated. On that note, a bit of a positive news. There was a small increase in the number of residents being vaccinated. More than 6,000 Allegheny County residents per week for the last 2 weeks received a COVID-19 vaccine. On Monday, the U.S. Food and Drug Administration, or the FDA, fully approved the Pfizer vaccine, which is truly a milestone moment that I hope results in increased vaccine confidence. The FDA is also expected to fully approve the Moderna vaccine very soon. The COVID-19 vaccines have been safely administered to tens of millions of people in the United States under emergency use authorization. But receiving FDA approval is a step beyond, and it further bolsters what healthcare leaders have been saying for many months. The COVID-19 vaccinations are incredibly safe and effective, and the data show it. As of last week, over 357 million doses of COVID-19 vaccine were given in the U.S. While some people experienced minor side effects such as aches and pains, fever, and fatigue, it's been extremely rare to experience serious side effects. I know that among skeptics, there's a belief that vaccines were rushed, that they were not studied long enough to guarantee their safety, but here's the truth. The COVID-19 vaccines have undergone intensive safety monitoring. They were studied and evaluated in tens of thousands of participants in clinical trials, including myself and our county executive. I volunteered to participate in the trials, to be a guinea pig, so to speak, because I knew how sound the science is behind these vaccines, and I was absolutely confident in their safety. And I'm glad I was right. The vaccines met the FDA's scientific standards for safety and effectiveness, and they continue to undergo extensive safety monitoring. When you stop and think about it, it's truly remarkable to consider what these vaccines represent and what they offer us. They represent scientific excellence, the ability to mobilize the greatest minds and problem solvers in the world to quickly create a safe form of protection against a virus that has killed more than 620,000 Americans and more than 4.5 million people worldwide. They and other vaccines are nothing short of a miracle, created by scientists designed to save us. We should not fear the vaccines or cast suspicions on them. We should celebrate them for what they are, lifesavers. I can't say it enough. The vaccines are to be celebrated. They are safe. They were not rushed, and they could very well save your life. As I've made abundantly clear, vaccines are vital to our response to this pandemic. As I have said also many times before, COVID-19 impacted communities of color disproportionately, both locally and nationally. It's therefore essential that vaccines reach communities of color with a goal to eliminate this disparity. To examine how we are doing with vaccine distribution as a county, today the Health Department is sharing on our vaccine information page from our county website both a short 2-page county vaccine summary report and a longer report that fully explains the methods we used in the analyses and the limitations of the data. Data are given as rates of vaccination per 10,000 residents by zip code. We report the zip codes with the lowest vaccination rates overall and by race and ethnicity. Based on these zip codes, we will work with community and vaccine partners to ensure that vaccines are easily accessible and available. We plan to report these data each month to follow our progress in addressing these needs. In addition to life-saving vaccines, scientists also developed monoclonal antibody therapy to treat people who get infected with SARS-CoV-2. Monoclonal antibody treatment reduces the risk of hospitalization and death from COVID-19, especially for those at higher risk for serious illness. So as a reminder, you are eligible for this treatment if you tested positive for COVID-19 and have had symptoms for 10 or fewer days and have at least one of the following. You're 65 and older, you have a BMI in the overweight or obese category by CDC standards, you're currently pregnant, have a long list of chronic medical conditions, are a current or former smoker, or have or had substance use disorder, have a history of stroke or cerebrovascular disease, have a neurodevelopmental disorder or other conditions that confer medical complexity, or have a medically related technology dependence, such as a tracheostomy or a gastrostomy. I want to remind you that the Health Department has a walk-in immunization clinic at the corner of the Boulevard of the Allies and Cherry Way. We and many other providers like pharmacies, healthcare organizations, and others continue to offer vaccine clinics across the county. If you need information on where to get a vaccine or need information about monoclonal antibody therapy, you can visit the county COVID website or you can call 211 for assistance. Another important reminder, the Delta variant is very contagious and can spread to the vaccinated when they themselves can also spread the virus. We have high levels of community spread here in Allegheny County. Therefore, I strongly encourage everyone to strictly adhere to the CDC recommendations to wear a well-fitting mask whenever indoors and around others, regardless of your vaccine status. In the era of Delta variant, again, I call on all schools to follow the CDC, the Pennsylvania Department of Education, and the Pennsylvania Department of Health recommendations for universal use of masks in K-12 schools. The health of your students and staff and your ability to continue in-person learning depend on it. And with that, I open it to questions. Thank you. Be safe and be kind.
The first question today is from Katie K. Is the county seeing more kids being admitted to the hospital or just getting sick with COVID now that school has started in some districts?
We have not at this point seen an increase in hospitalizations among children in our community. Again, like we reported, the cases are proportionate to, the cases in children have gone up a little bit, but we have not seen an increase in hospitalizations at this time.
The next question is from the Post-Gazette. Have there been any cases linked to the concert at PNC Park last weekend? If so, how many?
It's a little bit soon for that. Don't forget, after an event, you have to wait till you get symptoms, which takes a couple days to a couple of weeks, then you have to get tested, then you have to get your results back and have a case investigation. So it's just too soon to have that information.
This next question is also from the Post-Gazette. Are the daily case counts an accurate report or representation of the amount of transmission in the county, or are our testing numbers low?
So our testing numbers have appropriately increased over time. As our cases have increased, our testing has increased. You know, we've always said that there are more cases out there than we detect because not everyone goes to get a test. But there's no reason to think that we're in any of a different state than we have been. So I think it does reflect the general rate of cases in the community.
The next series of questions are from WESA. Since the start of the pandemic, the County Health Department has said that any mitigation guidance for K through 12 schools comes from the state, yet people, including some prominent local physicians, continue to implore the county to mandate CDC recommendations such as masking in schools. For clarity's sake, can you explain whether the county lacks the legal authority to instate masking or other health directives at K through 12 schools?
The County Health Department and Dr. Bogan would have that authority, and which she has been saying, and I have been saying consistently for weeks, is we strongly recommend that the school boards institute a masking policy, particularly to protect those kids under the age of 12, the children under the age of 12 who are not eligible to get the vaccine. According to recent reports in the state of Pennsylvania, 59 of the school districts across the state out of almost 500 have come in. And I'm proud of the fact that fully half of those 30 are here in Allegheny County, including most of the big ones.
Why not mandate masking at child care centers, which are private businesses and not under the jurisdiction of the school board?
They are, these child care centers are state-related agencies and are under the state guidance, and the state would be the one to mandate that. And I note that Governor Wolf today has asked the legislature to come back into session and asking them to institute just such a mandate.
The county's current vaccine policy is that unvaccinated employees must regularly get tested. Now that the FDA has given full approval to the Pfizer shot, will you require all employees to be vaccinated, including those who were employed prior to the release of the vaccines?
Well, first of all, we've been very pleased with the fact that when we made this announcement a few weeks ago, many of our county employees have decided to get vaccinated, and more are coming in every day. You're right, the mandate of testing on a regular basis, on a weekly basis, as well as the masking is in place. It is something that we'll certainly continue to monitor and take a look at. I know our law department and the county manager and the health department are continuing to monitor that. We are seeing more institutions, more companies, more places who are requiring vaccines, and I think you're going to see more and more of that, particularly with the approval this week of Pfizer, and I would be probably anticipate in the coming weeks that that Moderna and J&J would also see that certification.
This question from multiple outlets, I know you touched on this, but what are your thoughts on Governor Wolf's letter, his request that the state legislature consider requiring school districts to mandate masks?
I think it's very responsible, because I think what the governor is saying, earlier this year, the legislature decided that they wanted to be the ones to set the policy and kind of take some of that authority away from the governor and the Department of Health. So he's asking them to come in to session and have that deliberation and to protect the students across the Commonwealth.
And this final question is from the Tribune Review. Is there a rough timetable for when we might start to see more information regarding the number of breakthrough cases versus cases among the unvaccinated in our reports?
So I think I've said in the past couple weeks we're waiting for the state to merge the data sets that would allow that information to become available, and you'll have to check with the state to see when that will be available.
That was the final question, if there are any closing remarks.
First of all, I want to again thank Dr. Bogan and the Health Department for their continued work. You know, she's being a little bit humble when she says she was glad she was right. But she's been right on just about everything throughout this last year and a half. And the advice that Dr. Bogan and her team have given have kept us safe. And for people to take that advice, whether it's around masking, whether it's around vaccine, social distancing, all the things we've learned over this last year and a half have been protective of all of us in this community. And we're hopeful that the rest of the schools, as we begin the school season, takes that under advisement and takes that advice to heart. We know the under 12-year-old population does not have the ability to protect themselves with the vaccine. They can certainly wear a mask, and many of them do, but for the other folks that they come in contact with, we want them to be in place. That mask's in place mandate as well. And again, I'm very proud of the fact that 30 of the 59 school districts that have instituted mask mandates across the state have come from just one county, one out of the 67 counties here. And as I did last week, I want to congratulate the school districts and the school boards who have done everything to protect the students and the families in their communities. And I want to publicly acknowledge them. Allegheny Valley School District, Bethel Park, Clairton, Cornell, Fox Chapel, Gateway, Keystone Oaks, Montour, Moon, Mount Lebanon, North Allegheny, North Hills, Penn Hills, Pine Richland, Pittsburgh School District, Quaker Valley, Riverview, Shaler, South Fayette, Stowe Rocks, Upper St. Clair, West Allegheny, West Mifflin, Wilkinsburg, Woodland Hills, and then the ones with hybrid, Northgate, Hampton, East Allegheny, Carlinton, and Avonworth. And we hope the other ones that aren't in yet, that the boards take action to protect the students as they go back. Let's everybody get vaccinated. Let's everybody be safe as we enter the school and fall seasons. And we'll talk to you again next week. Thank you.
Our next regularly scheduled briefing is Wednesday, September 1st at 4 p.m. Thank you for joining us.